A question that comes up at MRI is the use of subtraction images, and I know Vivian Lee at NYU is a big fan of subtraction images. So what are they? Well, what that is you take the post-GAD image, you subtract the pre-GAD non-enhanced image, and you end up with what you're left with here is a subtraction image that, in theory at least, just shows you anything that is solid that is enhancing. And I think that's useful at times. Typically, I find it useful for a lesion that is bright on T1 pre-GAD, because I think it's very hard for your eyeball to determine if something that is bright pre-GAD is getting even brighter post-GAD. So I think then it can be helpful, though in reality, most of these bright T1 lesions on the T1 fat set pre-GAD are going to be hemorrhagic cysts anyway. So, I don't find it that useful perhaps, but it is something you can do. It does demand good registration, so if the patient hasn't held their breath in exactly the same position on the post-GAD image as the pre-GAD image, then this won't work anyway. So, when I've seen a focal renal lesion, I've decided it's enhancing. The next question I ask myself is there gross macroscopic fat present? Because if there is gross macroscopic fat, I'm going to call it an angiomyolipoma. That's a green light, that's a benign diagnosis. If there is no gross macroscopic fat visible, I'm going to presume it is a renal cell carcinoma. I will talk a little bit about some differentials, but for the most part, it's a suspected renal cell until proven otherwise, and that's a red light.